is all this?
Well, one of my patients, a man called Benchley, says the last time he saw Thorne, he wasn't calling himself Thorne at all.
Oh, is that all? Oh, he's made a mistake.
No, he's serious. And he says not only was Thorne going under a different name, but he wasn't even a doctor.
Can't be true.
Well, Benchley sounded pretty convincing to me.
Oh, it's a simple case of mistaken identity. I mean, Dr. Thorne must be genuine.
Why?
Well, a man of his obvious ability can't possibly be a phony.
Well, I'm simply reporting what my patient told me. Why would he invent such a thing?
Well, I'm not saying it's a deliberate invention. I mean, perhaps Thorne looks like someone Benchley once knew.
Well, he was certain it was Thorne, and equally certain he wasn't using that name.
What name was he using?
Well, he couldn't remember, but he knew it wasn't Dr. So-and-so.
Plain Mr. So-and-so. Where from?
He couldn't remember.
Well, what was his job?
He couldn't remember that.
Well, it's a bit flimsy.
Look, I know my patient.
Do you?
All right, so it's not cut and dry, but Benchley feels certain he can fill in the gaps, give him time to think about it.
Well, let's wait until he can, if he can. I suppose you want some coffee,
yeah?
Yes,
Sure.
You're always thirsty. Look, you've got to be very certain of your facts if you're going to accuse Dr. Thorne of being an imposter.
Wow.
Everyone knows you're prejudiced.
Rubbish.
Well, everyone knows you and Thorne have had differences of opinion.
So have you, for that matter. It's just I don't like him meddling with my patients.
Well, they're his patients, too.
Yes, but as long as they're in this hospital, they're my responsibility, and I don't need any middle-aged backseat driver to tell me how to do my job.
That sounds very unprejudiced.
You don't think I'd make up this story just to try and get rid of Thorne?
Oh, I understood it was your patient who made it up.
Nobody's making up anything. Yes? Baxter? Oh. Put him on.
Yes, Dr. Baxter. There you are, Mr. Benchley.
Dr. Baxter, I've remembered. That fellow Thorne. I know exactly where I saw him and what he was doing.
Well, I think that will do for today, Miss Smith.
I'm not being much help, am I, Dr. Stern?
These things take time.
Supposing my memory never comes back, I'll have to spend the rest of my life not knowing who I am.
I am sure that will not happen. Oh, excuse me. Well, she's well educated, well read, cultivated, and probably used to a high standard of living.
Yes, well, I was able to work that out for myself, but did you find out who she is or where she comes from?
How long does it take for a fractured tibia to heal in a young, healthy subject?
Oh, 3-4 weeks, but...
The mind is infinitely more delicate and complex than a tibia. I've been with a patient for 1 hour.
Yes, but I thought you had ways of making them talk.
Well, yes, she did talk. However, I don't understand...
Oh, no, forget it.
Dr. Baxter, I think we should move this patient to the psychiatric wing.
Well, I would prefer Miss Smith to remain here.
But I could give her more attention in
yes,
my
but I want to
ward.
keep my eye on that rather tricky fracture.
I would not do...
Look, I'm sure she would be better off here. Don't you agree, sister?
She certainly seems very happy in this ward, Dr. Baxter.
And besides, there's a more normal atmosphere here than in the psychiatric wing.
My patients are just as normal as yours, Dr. Baxter. Their symptoms are different, that's all. However, as I am short of bed, she might as well stay here. I will see you again tomorrow, Miss Smith.
Goodbye, Dr. Stern.
Right. Well, did you get anywhere with Dr. Stern?
I'm afraid not.
You don't need me, Dr. Baxter.
No, thank you, sister. You carry on. Well, we've got the police making inquiries.
About me?
Yeah.
That sounds rather sinister.
Why?
Well, we don't know what they might find out.
Well, I'm sure it's not going to be anything terrible. Well, you haven't got anything to hide, have you?
Well, I might have. Doctor.
Yeah?
I'm frightened.
Look, I keep telling you, there's nothing to be frightened about.
He's looking ever so much better.
Yes, good as new. He's just come off dialysis.
What's that?
That's...
The kidney machine.
That's right. Oh, I feel great.
It does the job his kidneys would normally do very satisfactorily, but it is time-consuming and inconvenient.
You can't beat nature, you see, Lenny. Much better to have a kidney of your own.
Which is why we've come to see you.
I wondered what it was all about.
We've come to see what you think about it.
Leave it to the doctor, Will.
Excuse me. Well, now, Leonard, we've given your case a lot of thought. And this is the situation.
Yes.
Yes?
Bottle.
What?
I want a bottle.
You can't have a bottle, Mr. Willis. You're quite well enough to get up.
Get up.
That's what I said.
I'm a very sick man.
What's all this noise about?
She says I've got to get up to go to the bathroom.
Well, it's not time for your bath.
Not a bath. You know.
Oh, I see. You mean the lavatory. Yes, well, Nurse Shaw's quite right. Now, come along, Mr. Willis.
Hello, chap. What do you think?
I don't know. I mean, I just want to get better.
If you have this operation, it'll make you better.
What do you think, Dad?
Oh, you have the transplant, Len. Dr. Ridge is right. You don't have to rely on a machine with the rest of your life.
If you say so, Dad. What happens now, Doctor?
Come on, Mr. Willis.
Didn't used to be like this. I can remember when patients were patients.
Not so much noise, Mr. Willis.
And nurses looked after them.
Look, come along. The sooner you get on with it, the sooner you'll be back in bed.
You don't think I can walk all that way on my own, do you?
All right, Nurse Shaw will help you.
It's a good story.
Is it?
A Jimmy Potter human interest special. Beautiful young woman stepped off train, knocked down by taxi, rushed to hospital, found to have lost her memory. Who is the beautiful mystery woman?
That's just the problem.
No. I was writing a headline.
Oh, so sorry.
What else can you tell me about her?
I don't think I can add anything.
What would you say her background was?
Oh, educated, well-to-do.
Clothes?
I don't know that I've seen them.
I'll have a word with one of the nurses. Is there anything else about her appearance? Any scars or birthmarks?
Well, Dr. Baxter is treating her for minor cuts and a simple fracture of a couple of bones in the foot. Perhaps you'd better talk to him as well.
I'll do that. Sure there's nothing else you can tell me?
I don't think so.
Pity she hasn't got a scar or a birthmark. Birthmarks are always good copy, especially if they're somewhere interesting.
Yes, quite. Well, let's hope that somebody is looking for her and sees your story.
Oh, we'll give it a good showing. If she's from anywhere around here, somebody will see it.
Good, because we'd like to get the matter cleared up. Otherwise, we're faced with the problem of what to do with her.
You do realize you're making a very serious allegation, Mr. Benchley.
True, Doctor. I haven't made it up. Why should I?
Well, tell us what you remember.
Well, see, Doctor, it's like this. I never forget a face. Pride myself on that. Once seen, never forgotten. Can't tell you the number of people I've surprised by it, sometimes even after 25 years.
Yes, Mr. Benchley, we'll take your word for it.
All right, so when I saw this fellow Thorne, I knew I'd seen him before.
Yeah, well, tell Dr. Ridge.
And knew I'd seen him, but I couldn't quite place him. You see, sometimes it's difficult when the surroundings are different. If he'd been a doctor, say, or something to do with the hospital, I'd have spotted him at once. But that's the very point. He wasn't a doctor, not when I knew him.
Look, how well did you know him?
Well, I didn't exactly know him, but I've seen him often enough.
Where?
Well, it wasn't up here, of course. It was when we lived in the south. And we've been up here, let's see, best part of 8 years.
Where did you see this man, Mr. Benchley?
I'm telling you, it was when we were living in Salisbury. This so-called doctor of yours worked in a local chemist.
As a pharmacist? Did he dispense prescriptions?
Oh, I think so, yes. In fact, he must have done. That's probably how he got to know the chat.
What chat?
Well, you know, the way you doctors carry on, the right names, all that sort of thing.
Now, let me get this straight. You are saying that the man we know as Dr. Thorne is an imposter.
He's not saying anything of
Now,
the sort.
let me deal with this. You knew him in Salisbury 8 years ago.
Yes.
And at that time, he was not practicing as a doctor, but working in a local chemist.
Yes.
Yeah, what was the name of the chemist?
Oh, I can't remember.
That you apparently can remember Dr. Thorne.
Faces I never forget. Names, forget my own sometimes.
So you wouldn't be able to tell us what name the man was using at the time?
Oh, I doubt if I even knew it.
But you do know that Dr. Thorne and the man you knew in Salisbury are the same person.
Not a doubt of it.
You'd better be absolutely certain, Mr. Benchley, or you'll be in very serious trouble.
Oh, that fella's no more a doctor than I am. Stake my life on that.
Yes, well, thank you, Mr. Benchley.
What are you going to do about it?
You just leave it to us.
Because if you don't do something, I will.
All right, Mr. Benchley. I'll attend to it personally.
What have you been doing to this bed?
Nothing.
Look, come on. Let's get these pillows straightened up.
I'm all right, really, nurse.
It's not you I'm worried about. Mr. Parker Brown.
Who's he?
He is a consultant and a very important man, so none of your sauce, young Leonard.
Hello, Leonard. How are you?
All right, thanks, Doctor.
This is Mr. Parker Brown, who's come to have a look at you.
Hello.
You seem fairly cheerful, young fellow. X-rays?
Heart reports?
Up a bit. Expected. Thalmoscope? Now, lie back. Look straight at the ceiling. Keep quite still. Quite still. And turn your head towards me. Keep looking straight up at the ceiling. That's it. Fine. Apart from those kidneys, you're a pretty fit young man.
I play a lot of football. I mean, I used to.
Until your kidneys let you down. We'll have to see what we can do to put that right.
Will you give me 2 new kidneys?
Luckily, one will do perfectly well. It enlarges to do the work of 2.
Then I'll be able to play football again.
If it works, I don't see why not.
How soon can we start?
Ah, well, that will take a little time. You see, we can't give you just any old kidney.
It's not going to be difficult, though, is it? Well, is it?
Oh, Doctor,
Yes?
could I have a word with you, please?
Yes?
It's about one of your patients,
Who?
Miss Finch.
Oh, yes?
I know it's none of my business, Doctor.
Is something worrying you?
I don't think you're treating her right. She's a sick woman.
Look, there's really nothing wrong with Miss Finch. In fact, we'll be discharging her soon.
She said you'd say something like that.
Yes, I'm sure she did. She doesn't mean any harm.
I don't know how you could have been so unfeeling. You left her in tears yesterday.
Now, look, Miss Finch is just a little imaginative. She's inclined to be
What's
over...
she doing in here, then?
She was admitted with a chest infection. She really was ill. But that we can cure with antibiotics.
Oh, I see.
Look, the truth of the matter is that people avoid her because she depresses them.
That's true enough. She seems to feel better if everyone else is worse off than she is.
Yes. It's a vicious circle. She likes everyone to be aware of the same fears that she has. And so they desert her.
We'll have to do something about it then, won't we?
Thank you.
You don't mind if Dr. Thorne sits in with us?
Family doctor?
Yes, yes.
Not at all. Sit down, please. There are 1 or 2 things still to be discussed. As I said, there are 1 or 2 things to be discussed. The main problem is finding a kidney.
I thought you could apply for one through a computer or something.
An index is kept of people willing to donate kidneys and of patients who require them.
But the kidneys do have to be matched to the patients. Otherwise, they would be rejected by the body.
Now, this matching is a very precise business. It's done by a computer in Bristol. From the time a donor's kidney becomes available, we have 12 hours to match it, get it to the patient, and operate.
So Leonard might have to wait quite a time for the computer to find one for him.
It's possible. On the other hand, he might be lucky.
Supposing it doesn't take?
The tissue grouping technique is very sophisticated, which means that the chances of rejection are minimal.
When you can get a kidney, however long that takes.
There is another way, and it saves waiting.
What's
That's
that?
Kidneys from close relatives.
As I was about to explain, Dr. Thorne, kidneys from close relatives, mother, father, brothers or sisters, are most unlikely to be rejected.
Does that mean one of us could give a kidney?
Exactly.
Well, I can't think why you didn't suggest this before, Doctor.
Well, it means a major operation.
Don't go
Of course
making
you have
mountains
to.
out of molehills. Perfectly straightforward piece of surgery. Not for beginners, of course, but nothing to worry about.
Will you be doing it?
I shall be assisting Sir George Dysart, assuming he's free.
An excellent man. Leonard couldn't be in better hands.
Fine, so what are we waiting for? You can have one of my kidneys as soon as you like.
No.
What?
I won't let you do it.
You don't give up, do you?
Oh, nor do you.
I'm just not convinced, that's all.
Well, Benchley wouldn't make up that sort of thing about Thorne. I mean, where's the point?
Well, maybe it was a genuine mistake.
Well, I don't think so.
Damn it. Thorne's a first-class family doctor. You don't pick all that up in a chemist shop in Salisbury.
You physicians stick together, don't you? Loyalty to the boss and all that.
What's my boss got to do with it?
Well, Armstrong's the medical administrator. He got Thorne to accept a part-time consultancy, the only GP in the hospital.
So?
Well, sir, he's going to look a bit silly if Thorne turns out to be a phony.
Well, I don't see why. Thorne's never done anything questionable. You never had any reason to suspect him. You're merely judging him on the unsupported word of a layman.
All right, so I'm sticking my neck out. But I believe Thorne is that man in Salisbury. I also believe there's some reason why I went into hiding, and until we find out what that reason is, he's got to be kept away from the patients.
You think it's as serious as that?
Yes. We can't take any risk. We don't know anything about this man or what he's been doing for the last 8 years.
That's true, and Thorne isn't who he says he is, then they've got no alternative. They've got to expose him.
Good thinking, Doctor.
Look, if we're wrong, we're the ones that'll be jumped on from a great height.
True.
No.
Mrs. Tate, your husband would make the ideal donor.
I won't let him.
Why not?
But you said it was a major operation.
It doesn't worry me.
Well, it worries me. You and Lenny both here in hospital. I'd be out of my mind with worry. Anyway, it's not your job.
Well, whose job is it then? Yours, I suppose. Well, it wouldn't work, would it? I mean, you can't put a female kidney into a boy.
No problem there, Mr. Tate. Kidneys have no sex.
I must have a decision so that I can advise Sir George.
I've told you, you can operate on me.
No, it's no good. I'm not going to let you have your own way.
Look, I'm the head of the family.
Well, that's just it, isn't it? You're the wage earner. You can't afford to be off work for long.
We'll manage somehow.
And who does the managing? It's me, isn't it? Oh, it's all right when the money's coming in, but with you in hospital...
Well, how long would I have to be off?
Not long, 2 or 3 weeks.
Of course, you wouldn't be able to go back to anything very strenuous. You'd have to take it gently for a while.
Supposing there are, what you call them, complications.
It'll be all right. He said it was perfectly straightforward.
You might be ill afterwards. He could be, couldn't he?
It's possible.
You see? But why don't you listen? Besides, what would there be for me at home with you and Lenny both here in hospital?
You could have that nice rest you're always on about.
I think your wife has made out a good case, Mr. Tate. What do you think?
Well?
Oh, yes, I do, yes.
Doesn't matter who donates the thing. Let's get on with it.
It would seem more practical for your wife to be the donor, Mr. Tate.
You see?
But I'm the boy's father. It's more natural.
It's not more natural than me being the mother.
Mr. Tate.
Oh, all right. All the same, I would have liked to help Len, give my son part of my body. Well, that's something not many fathers...
Well, when will you do it, Doctor?
Let you know in a day or two. Ring George Dysart now. All depends on him.
Of course, we'd have to run a few tests before we bring you into a ward. I'll make the necessary arrangements.
Oh, thank you, Doctor. So, we wait till we hear from you, right?
That's right. Goodbye, Mr. Tate. Mrs. Tate. Phew. Well, you didn't have much to say.
Well, I didn't want to bring it up just then. There seemed to be enough to worry about. But there could be a problem.
Something to do with the parents?
The mother, anyway.
Serious?
Yes, it could be. Could be serious.
Ah, Peter.
Oh, Martin?
I've just been into town to see if I could find someone's surgery.
And did you?
Yes. It's not the most fashionable part of town. Council houses, workers' colleges, but the surgery's there, all right. The locals think well of him.
Been making a few inquiries, have you?
Well, I asked in the local pub. Oh, and a few of the shops. I also asked if they could recommend a good doctor. They all recommended Thorne. I think you're right. Benchley has made a mistake.
Well, there's certainly a Robert Thorne in the register. Come and see. I've got it here. Yeah.
MRCS, LRCP. Well, that's definite. He's qualified.
Yes. There's something else that's relevant.
Ah. His address?
Given as Barnes, London.
Yes, but he's been working up here for the last 7 years.
Exactly.
What do you make of that?
Benchley could be right after all.
Well, you're changing sides all of a sudden, aren't you?
You can't ignore the evidence.
Well, there might be some reason he didn't inform the BMA. He might be one of those who refused to pay the 5-guinea subscription.
Well, there's only one Robert Thorne in the register. If that isn't our man, who is he?
Come in. Oh, hello, Mrs. Tate. Do come in. Please sit down. I won't keep you a moment. Oh, now, have you seen Leonard this morning?
Yes.
Please, do sit down.
He's getting a bit fretful. Wants to have the operation over and done with.
Yes.
Well, so do I, come to that. Well, now you've done the test, it won't be long, will it?
Mrs. Tate, I have to tell you that you can't be the donor.
I can't.
No.
But why? I mean, you said with me being the mother, it'd all be all right.
The tests we ran show that you suffer from chronic pyelitis.
Well, I've got used to it. Doesn't bother me, not really.
Yes, I dare say. But I'm afraid you can't help Leonard.
Oh.
I'm so sorry. I know it must be very distressing for you.
I did want to do something for Lenny. Make him well again.
Yes, of course. Still, the situation isn't hopeless. Your husband can be a donor.
No. No, it's a sign. Lenny's not going to have that operation. I won't let him.